Greetings everyone, your Optom coach this side, and today I will be talking about osteology of the skull. Now, why is it important? Because the eyes are present in a protective covering which is formed by the bones called the orbit. This orbit is in turn a part of the human skull. So, we'll be discussing the osteology of the skull in brief. Now, coming to the general arrangement and features of the skull is divided into two parts, the cranium and the facial skeleton. So, the cranium or the neurocranium is the upper part which is shaped like a bowl. It contains the brain and further subdivided into cranial vault and cranial base. The facial skeleton or the viscerocranium is the lower part. The skull is composed of large number of separate bones. These bones are united by fibrous immobile joint sutures, and the connective tissue between the bones is called sutural ligament. Now these are the MCQ points. The exception to this is the mandible, which is united to the skull by a mobile temporomandibular joint. The skull bones are made up of an external and internal tables of compact bone. They are separated by a layer of spongy bone called the diploid. This is again a MCQ point. The internal table is thinner and more brittle than the external table. The bones are covered on the outer and inner surface with the periosteum. Now the outer layer is referred to as the pericranium and the inner covering the endocranium. All these are MCQ points. Coming to the cranium, the bones which make the cranium, there are 8 bones, out of which only 2 are paired. These are frontal, parietal, which is paired and also the largest cranial bone, occipital, temporal, sphenoid and ethmoid. So these are the 8 bones that form the cranium. The facial skeleton consists of 14 bones, out of which only 2 are single. So in the cranium 2 are paired and in the facial skeleton only 2 are single. These are zygomatic, maxilla, nasal, lacrimal, vomer, palatine, inferior concave and mandible. Now the vomer is single and the mandible is single. Lacrimal is the smallest bone of the face and vomer forms the posterior part of the nasal septum. These are the MCQ points. Coming to the cavities, the skull contains a number of cavities that reflect its multiple functions. It contains a cranial cavity which houses, supports and protects the brain, the nasal cavity which is concerned with respiration and olfaction. Olfaction is the sense of smell. Then orbits which house the eyes as well as its adnexa, and the oral cavity, that is the buccal cavity. So it is the start of GIT, that is gastrointestinal tract. It is responsible for mastication and initial food processing. It also houses the taste receptors. Many of the cranial bones contain air-filled spaces, also called the paranasal sinuses. We'll be discussing this in detail in a different presentation. Thank you.